will be preparing my medicine trolley. Now I'm going to wash my hands first. Hands are washed. And I'm going to clean my medicine trolley, which is right over here. So I'm going to put this in 4 sections. I'm going to clean from one side to the next. One side to the next. I'm going to flip it over and clean again. One side to the next. And one side to the next. I'm going to discard of my tissue or towel. Now I'm going to wash my hands again because I touched the dirty medicine trolley. And now I'm going to set up my equipment. So I'm going to get a saucer. I'm going to get my spoon, a knife, my medicine cup, my water, a cup, and some napkins. And then I'm going to get my garbage bag. I'm going to place it on here. Okay, now I'm going to wash my hands and get started with preparing my oral medications. Okay, so I will be administering oral medications. So first step will be to wash my hands. So I'm going to wash my hands, and now I'm going to go and check the physician's order. Okay. So I'm going to read off the physician's order from top to bottom. So the patient is diagnosed with hypertension, diabetes, and schizophrenia. The patient's name is Raven Scher. Date of birth is June 1st, 1970. She weighs 200 pounds. Her medical record number is 432-30876. Her account number is 12546789. She's on female medical 1. She's on bed 10. And her consultant is Dr. K. Bethel. She was admitted to female medical 1 on August 29, 2019 at 9 p.m. Her condition is stable. Her allergies, she doesn't have any drug allergies. Her diet is low salt. She is on bed rest. Her vital signs are every 4 hours. Her investigations are CBC, chest x-ray, ECG, and ABGs. She's on, her medication would be chlorpromazine, 50 milligrams orally 3 times a day, Cogentin 1 milligram orally twice a day, Zestro 20 milligrams orally once a day, glucophage 500 milligrams orally twice a day, haloperidol 10 milligrams intramuscular every 8 hours as needed, labetalol 50 milligrams intravenous for systolic blood pressure over greater than 100 millimeters of mercury. And the physician is R. Black. And now I'm going to compare the physician's order to the MAR. And I will check the name. So the surname is Scher. Her first name is Raven. She is 50. And her medical record number is 432-30876. And the medications that she will be getting today, because it's 10 a.m., we'll be getting Zestro 20 milligrams orally once a day. Now I'm going to wash my hands. I'm going to introduce myself to the patient. My name is student nurse Neely. How are you?
Mom, I'm okay.
Okay. So I'm going to be giving you some medication that the doctor prescribed to you. Is that okay?
Yeah.
Alright. So I just want to check your armband to see if I have the right patient. Okay. And can you tell me your name and date of birth, please?
Raven Scher, 1st of June, 1970.
Okay. So I'm going to go and prepare the medications, and when I come back, I'll tell you all about it.
Okay.
So I'm going to wash my hands because I just finished introducing myself to my patient and I touched her. So now I'm going to check, make sure I have my physician's order and my MAR for reference. Now I'm going to go over my 5 rights to make sure I checked off on all of them. So prior to this, I checked to see if I had the right patient, the right medication. I checked to see if I had the right dose, the right time, and the right route. I already checked to see if the medication was available, and it is. So now I'm going to do my first check when I take it out of the medication drawer. So, okay. So on this, it has the ward, which is, I'm going to now compare it to the physician's order. So ward, female medical 1, which is correct. Date of birth, June 1st, 1970, which is correct. Patient name, Raven Sure, which is correct. The medication is Zestro 20 milligrams, which is right here. The doctor is R. Black, which is right here. And the expiration date is the 1st of January 2020, so it's not expired. So now, since the medication is the same amount as what is ordered from the doctor, I don't have to do any calculations. So 1 pill would be 20 milligrams. So now I'm going to do my second check, and I'm going to read it over to make sure I have the right. So ward, female medical 1, which is correct. Date of birth, June 1st, 1970. Patient name, Raven Sure. The medication is Zestro 20 milligrams, which is correct. The doctors are Black, and it expires January 1st, 2022. So now I'm going to place this here. Trolley is set up with my physician's order and MAR next to me for reference. Okay, so Ms. Sure, I'm back, and I've come to give you medication as we discussed earlier. Okay, so what I'll be giving you is Zestro, and that's just for your hypertension. And if you have some side effects are headaches or dizziness, so if you feel any type of way, like what I just explained, then you can tell me. Do you understand?
Yeah.
Okay, so are you ready to take them?
Yeah.
Alright, so I ask for consent. Now, are you comfortable? Do you want to sit up a bit more?
Yeah.
So I put her in the necessary position that she needs to be in. So I'm going to pour her water. But first, before I give her the medication, I'm going to do my third and final check. So ward is female medical 1. Date of birth is June 1st, 1970. Patient's name is Raven Sure. The medication is Zestro 20 milligrams orally once a day, and it expires January 1st, 2020, and the doctors are Black. So I confirmed the medication, so I'm going to put it back. Okay, Ms. Sure, I'll need you to remove your mask. Alright. Okay. So here's your medication. And your water.
Thank you.
I have made sure that the patient took her medication, and now I'm going to discard of all the waste materials that I used. While still watching my trolley, now I'm going to wash my hands while still watching my trolley, and now I'm going to document the medication that I gave her and put my signature. Okay, now let's document it. Now I'm going to carry the medication trolley back to where it originally was. Okay, so I put my trolley back to where it was. I'm going to now get her hand towel and clean the trolley like I did earlier when I was preparing it. So I'm going to do one side, the next side, again, the next side, and the next side. I'm going to discard this Okay, so I'm going to wash my hands after cleaning the trolley for the final time, after administering the medication. Then I am going to go back to my patient in 30 minutes to 45 minutes, and I'm going to check on them to see how they're doing. And that is me preparing my trolley and administering my medication. This is Student Nurse Neely signing off.